Hello everyone, my name is Dr. Sumandeep Kaur. This video is about providing general information about diabetes. There are so many questions that encircle the topic of diabetes, and today I'm going to answer all those questions one by one. So the first question is, can diabetes be prevented? Unlike type 1 diabetes, type 2 diabetes can sometimes be prevented. Although kids and teens might be able to prevent or delay the onset of type 2 diabetes by managing their weight and increasing physical activities, other risk factors for type 2 diabetes cannot be changed. Question 2. Can diabetes be reversed? Medically speaking, there is no cure for diabetes, but it can go into remission. Diabetes in remission simply means the body does not show any signs of diabetes. However, the disease is technically still there. Here, remission can take different forms. Partial remission. When a person has had a blood glucose level lower than that of a person with diabetes for at least 1 year without any diabetic medication. Complete remission. When the blood glucose level returned to normal, not simply pre-diabetic levels, for at least 1 year without any medication. Prolonged remission. When complete remission lasts for at least 5 years. Even if a person has had a normal sugar level for 20 years, their diabetes is still considered to be in remission rather than cured. There is no known cure for diabetes. The good news is that remission is possible in many cases and can be as simple as making some lifestyle changes. Next question. How do I know if I have diabetes? Diabetes symptoms may occur over time or they may appear quickly. The various types of diabetes that have similar or different warning signs are as follows. Some general warning signs of diabetes are extreme thirst, dry mouth, frequent urination, hunger, fatigue, irritable behavior, blurred vision, wounds that does not heal quickly, skin that itches or is dry, yeast infection. Talking about signs of type 1 diabetes, it is generally diagnosed in children and young adults, though it can occur at any age. A child experiences the additional symptoms such as sudden unintentional weight loss, wetting the bed after a history of being dry at night, a yeast infection in the prepubescent girl, flu-like symptoms including nausea, vomiting, breath that smells like fruit, problem breathing, and loss of consciousness. In type 2 diabetes, following symptoms can be seen. Persistent infection or a slow healing wound, complication that is associated with prolonged high blood sugar levels, such as numbness or tingling in the feet, and heart problems. Though these signs are not noticed suddenly and appears slowly over the time. Question 4. Who is at the risk for diabetes? Talking about type 1, the people at risk are children, young adults, and those with an immediate relative that has type 1 diabetes. For type 2 diabetes, those over the age of 45, those who are overweight, those who are inactive, those who smoke, those who have a family history of diabetes, those who have high blood pressure, those who have abnormal triglyceride or HDL cholesterol levels, those of certain ethnicities, and those with a history of insulin resistance. Question 5. Does intake of sugar causes diabetes? This is a very common question and often used in a statement such like, do not have much of sugar or you will develop diabetes. To answer this question, I'd say both type 1 and type 2 diabetes affect the body ability to regulate blood sugar levels, but eating sugar will not cause type 1 diabetes. Type 1 diabetes is an autoimmune condition which causes the body to attack cells that produce insulin. Damage to the cell undermines the body's ability to manage blood glucose. Type 2 diabetes is more complex. Sugar consumption will not directly cause diabetes. However, excess sugar consumption can cause weight gain. Obesity increases the risk of diabetes. Once a person has diabetes, eating too much sugar can make symptoms worse, since diabetes make it more difficult for the body to manage blood sugar levels. Next question. What to do once you know you have diabetes? There are various things that can be done that can help in maintaining sugar levels. Maintaining diet is one of them. Let's discuss what to eat, what not to eat, what to do, what not to do. Starting with what to eat. Consume high fiber cereals. Consume whole grains like wheat bread, wheat pasta, low fat and multigrain crackers, low sugar, whole grain cereals and brown rice. Add garlic and onions to the diet. Consume cheese and yogurt but prepared from skimmed milk. Consume green vegetables, black gram and fish. Consume fruits like gooseberry, apple, peaches, pear, orange, guava, jambul, pomegranates, cranberries and apricots. Add black gram into diet. Add barley, corn, millet, buckwheat and rye to diet. For barley, make a flour mixture with 1 part barley, 1 part black chickpeas and 4 part whole wheat flour and use them in making chapatis, pancakes and bread. Use pungent spices like pepper, cayenne, mustard seeds and ginger in your daily diet. Have 30 ml of bitter gourd juice in the morning empty stomach or simply add it to your daily diet. Add methi, that is fenugreek, seeds in diet. Soak 4 tablespoons of fenugreek overnight in water and then chew them in the morning. Do this for about 3 months of period. Another way of consuming fenugreek is take fenugreek seed powder, about 100 gram, mix it with turmeric powder, 25 mg, and take that mixture with a glass of milk twice a day. Another way could be taking the methi seed powder, mixing it into the wheat flour and using it as a chapati to eat. Add cinnamon powder to your daily routine. Take 3 to 4 tablespoons of cinnamon powder, add it in 1 liter of water and boil it for about 20 minutes. Once boiled, cool it down and drink it. Another remedy could be jamun seed powder. Take 1 tablespoon of jamun seed powder twice daily with lukewarm water. Or have 20 ml of amla juice twice daily. Ginger tea is another great help. You can have a cup of ginger tea 2 to 3 times a day to help with diabetes. Apart from adding these things to your consumption, there are certain things that you should not avoid completely, but reduce the consumption of these things. They are as follows. Reduce the consumption of bananas, pineapples, and figs. Reduce the intake of oats, rice, and wheat. Soya bean and tofu consumption should also be reduced. Now, there are certain things that should be avoided. They are sweet fruits like pineapple, grapes, mangoes, etc. Avoid potatoes, sweet potatoes, taro, yams, fruit grains, and pulses. Also avoid whole yogurt, which is high in fat. If you have to consume yogurt, use skimmed milk. Maintain the following in your everyday regime, like brisk walking. Walk for up to about 30 minutes in the morning and 30 minutes in the evening every day. Drink water from copper vessel and avoid sleeping during the daytime. Now, apart from what to eat and what not to eat, let's discuss what kind of yoga postures can be followed. There are so many yogas that you know about. Out of these, there are certain which help with the people with diabetes. I'm gonna list them. First one is Surya Namaskar, also known as sun salutation. Then there is Sirsa Asana, that is headstand. Veer Asana, that is hero pose. Mayur Asana, which is peacock pose. Paschimottanasana Asana, seated forward bend. Vriksha Asana, tree pose. Veerbhadra Asana 1 and 2, which is warrior pose 1 and 2. Utthita Pravakonasana, extended seed angle. Setu Bandh Sarvanga Asana, the bridge pose. Jathar Parivarta Asana, the alligator twist. And Shava Asana, the relaxation pose. I will soon make another video where I will perform all these postures and describe the benefit of each posture, also discussing which of these postures should not be performed in which of the added conditions. Thank you very much for watching the video. Stay happy, stay healthy.